So is the knee really a dumb joint? Many believe this to be the case with the idea that the knee is a slave to the hip and the ankle, but there's some big problems with this line of reasoning. So firstly, this idea often leads to practitioners immediately blaming the hip or the ankle as the root cause of all knee pain issues, and this then often leads to them avoiding the knee during assessment and rehab. And secondly, this idea of the knee being a dumb joint is mainly a kinematic idea about joint angles, but it doesn't give us any information about the kinetics or the forces moving through the lower limb. So for example, it is true that if my foot is constrained against the ground and I internally rotate my hip via the femur, this will influence the knee because the knee joint and the hip joint share a common segment, the femur. And this will often lead to an external rotation of the tibia relative to the femur. But again, these joint angle changes don't tell you anything about the forces moving through the lower limb at the same time. And lastly, these coupling behaviours like femoral internal rotation and tibial external rotation have led to many practitioners creating overly complicated scenarios and connecting them to knee pain. A common example of this overly complicated reasoning is the coupling between the pelvis and the femur. So when the pelvis tilts forward, it often couples with a femoral internal rotation. And practitioners will then say that this femoral internal rotation will have to be compensated by tibial external rotation. And they'll say that this is what creates excessive strain and pain at the knee. And then they'll use that to come back and say that this is why that anterior pelvic tilt is bad and needs to be corrected.